The BBL, or Brazilian butt lift, has one of the highest mortality and complication rates of all the plastic surgery. It is something you should know about. People want BBLs because they usually want a better, bigger butt. Maybe their butt is misshapen, maybe it's flattened, maybe it's too small, maybe they simply want to change. Now, if you're wondering why a family doctor is talking about plastic surgeries, it's because I'm often counseling my patients about plastic surgery that they may be contemplating, or I'm doing a pre-op evaluation for them, or other things. So it's really important for me to know. What happens in the BBL is fat is transferred from one location, like the abdomen, etc., lower back. It's transferred to the buttocks. So in many ways, it's like I don't want to say 2 for 1, but you're getting fat taken out of an area that you likely want it out of, and you're getting it put in your butt, which you likely want it in. Now you're saying, what's the problem? Why is this potentially such a dangerous surgery? And let me tell you why or how. When surgeons are taking that fat from the abdomen or the back or whatever, and by the way, before it's transferred into the buttocks, that fat is reprocessed and they sort of formulate it, okay, and then they put it into the buttocks. The thing about it is, if it's put into the buttocks in sort of an inappropriate or incorrect way, fat could actually get into some of the blood vessels. Obviously, this is not the intent, but it's one of the potential risks of it. Now, fat in a blood vessel, in these blood vessels, could potentially cause that fat to travel to the heart and the lungs, causing potentially death. That's right. That is one of the things that is so potentially deadly about this procedure. So you may be saying, well, okay, does this mean I shouldn't get it? Are you telling me not to get it? Nope, that's not what I'm saying. What I am saying is that a couple of good things have happened over the years. There was a task force developed to look into the mortality and complication rates, BBLs. And this task force came out with recommendations for surgeries to perform the BBLs in a safer manner to potentially lower these risks that I talked about. Namely, the one we're really scared of is fat going into the blood vessel, which can travel to the heart and lungs and cause immediate death. So that's a good thing. So, it's not saying that you can't get a BBL. It's to say that you need to understand some of the risks of BBLs. Now, that is not the only risk. It is, say, a very, very deadly potential risk. There are other potential risks, infection, etc., which surgeons are really great at going over with their patients. If you are interested in a BBL, there are ways that you can lower your risk of having complications. And I'm going to give you a few suggestions. By the way, this is according to the American Board of Plastic Surgery and American Society of Plastic Surgery and other organizations. First of all, you want to make sure you are going to a board-certified plastic surgeon. Listen to me. Board-certified plastic surgeon, okay? How do you know? You can check online. You want them to be board-certified by the American Board of Plastic Surgery. You can actually check their website for more information on how to find out if your surgeon is board certified. Board certification means that your doctor has done a certain amount of training and passed certain milestones to say that they have a certain amount of knowledge that is required for them to practice. Okay, that is very important. The next thing, you want to understand how many BBLs your surgeon has done. You don't want to go to a doctor that hasn't done many of these. You want a doctor who's very experienced in these. Okay, and I would argue that's the case probably with any surgery. All right, you want someone who's experienced. The other thing is you want a doctor who is thorough. When you meet with them for your pre-surgery consultation or for an information consultation, you want a doctor who spends time with you, goes through risks, benefits, your risks, potential complications, and everything. You've got to feel comfortable. You have to feel like they are hearing you, seeing you, listening to you. The other thing that you can do is you can actually look up to see if your doctor has had any lawsuits. It's really important, okay? Look up to see if they've had any lawsuits. You can look online for this. Look them up in general. Now, we know that patient reviews are not always accurate, or reviews online, but you know what? Oftentimes they are very accurate. Look this information up so that you have a lot of information to help you make the right decision for you. Remember, cheap is not always better, all right? I know a lot of people sometimes are looking for a deal, and sometimes patients choose the cheapest surgeon. Money, or the cost of the surgery, is not the way you should choose a surgeon. I would also be cautious about going overseas to have your surgery done. Number one, are you able to ensure the qualifications of your surgery? Number two, if you have any complications, what's going to happen? Are you going to be in another country where you're going to have to be in their hospital system, etc.? Do you speak the language? Are you able to communicate? Will your healthcare insurance cover it? Who's going to do your follow-up care and things like that? These are all things to think about. There are other things as well. The point is you should talk to your general family doctor, internist, etc., because we can help guide you. But also make sure that you do your research and really only go with someone who has board certification by the American Board of Plastic Surgery. As a family doctor, this is really important for me, for my patients. Let me know if you've had a BBL or other plastic surgery. Let us know how you've gone about your plastic surgery journey, like how you research your doctor, etc., because that's going to help other people. I'm Dr. Jen. Please subscribe to my channel. Follow me on Facebook. I'm on TikTok, Instagram, LinkedIn, WhatsApp, Threads, etc. Also, go to my website, drjencaudle.com, to sign up for my weekly health newsletter, guys. I'm Dr. Jen. Love y'all.